Hello, I'm Dr. Shekhar Sharma, and today I'll be talking to you about gallstones and the treatment. So, what are gallstones? Gallstones are small, hard, pigmented deposits, sort of like pebbles, which form in the gallbladder. Gallbladder is a small pear-shaped organ which sits under the liver, and the main function is to store and concentrate bile. Bile is produced by the liver and is essential for digestion of fat in the body. Due to various reasons, if the composition of the bile is not as much in balance as the body would want it, there can be deposition, much like crystals forming in concentrated salt solution, and these stones form. Very interestingly, gallstones are quite common. Maybe up to 30% of the people will have it. However, majority of the gallstones are what we call silent, in this way that there are no symptoms related to it. At times, symptoms do develop, and that is when we need to be aware of these and treat, because it can lead to serious complications. So, what are the symptoms of the gallstones? Symptoms of gallstones are because of the stones trying to pass out of the gallbladder into the ducts which connect the liver to the intestines. Because these ducts are quite small, and the stones can range from small grains of sand to large golf ball sized stones. As the stones try to pass into these ducts, it can cause symptoms which include pain, also called biliary colic, infection called cholecystitis, problems with the ducts themselves getting blocked, causing problems in the liver called cholangitis, or problems with the pancreas called pancreatitis. When the stones are trying to pass through, the most common symptom is biliary colic. It is a sharp, severe, intense pain which usually starts after meals or at bedtime, usually felt in the midline or towards the right of the upper part of the abdomen, can be radiating to the back, especially middle of the shoulders, or going to the right shoulder. It is usually intermittent, lasting for short periods of time, for up to 30 minutes or longer. If the gallbladder becomes swollen or infected, it is called cholecystitis. To avoid complications progressing further, sometimes which can be life-threatening, especially if the liver or the pancreas is affected, we do need to treat it. While kidney stones can be removed without removing the kidney, unfortunately, this is not the case with gallstones, because the whole gallbladder needs to be removed. Most often, it is done through a keyhole where small cuts are made to allow sharp instruments to be passed in, and gallbladder is removed much like using chopsticks. 9 out of 10 times it is successful. Occasionally, we may have to make a bigger cut to remove the gallbladder. That is called conversion to open, but that is quite unusual. It is a common surgery that we do, and often patients are discharged on the same day. I do get questions that people are quite concerned, what would happen to me if I don't have a gallbladder? Now, while gallbladder does play a role, it is not what we call an essential organ, and you can have a healthy and productive life even without a gallbladder. So, in terms of gallstones, if you have any problems, please do make sure that you follow up with your GP, get appropriate tests like ultrasound, and I'll be happy to guide you further if need be. A very interesting fact towards the end, gallstones are better detected with ultrasound rather than with a CT scan. Thank you for your time.